Before talking about the symptoms or the treatment that we should apply in cases of hyperactivity in dogs, it will be essential to understand that there are two types of hyperactivity in dogs. The physiological hyperactivity. Pathological hyperactivity, hyperkinesis. It is very important to be clear that physiological hyperactivity can occur through learning, or due to disorders related to separation, for example. However, hyperkinesis, due to pathological reasons, is caused by an alteration of the dopamine pathways in the dog's brain, which will require veterinary treatment. Symptoms of hyperactivity in dogs. Because there are two types of hyperactivity, we will explain the symptoms separately from each of them. Take note of both to know if your dog may be suffering from any of them. However, remember that the physiological is the most common. 1. Physiological hyperactivity. Below we will show you the most common symptomatology in dogs. Remember that you do not have to experience all those mentioned below. Destructive behavior in the presence or absence of the owner. In the moments of game they show hyperexcitable and they do not have any control. They can even do damage without wanting it. Lack of inhibition of the bite and other behaviors. Demands of constant attention to the owner, which include crying, whining and howling or destructive behavior. Generalized frustration. They do not achieve many of their objectives, usually because the owner tries to avoid it. He responds in an excitable way to any stimulus out of the ordinary for him. He usually has an alert attitude, but can never concentrate. When an order is given a sit down, it looks at the one who issues it but fails to incorporate the movement, generally, doing the opposite of what is ordered. Light and brief sleep with frights at the slightest noise. Reacts in an exaggerated way to the smallest change that occurs. He does not learn what he is taught because of his high level of stress, which is also aggravated by lack of sleep. You cannot control the sphincters correctly, urinating anywhere, without a reason according to their canine habits, although this symptom does not always occur. 2. Pathological hyperactivity, hyperkinesis. Now that you know the symptoms of physiological hyperactivity, it's time to compare them with the symptoms of pathological hyperactivity. Very high activity level. Inability to relax, which may affect the dog's normal sleep. Exaggerated response to different stimuli. Difficulty of learning, related once again with lack of sleep. Possible aggressive or reactive attitude to different stimuli. Appearance of barks or related behaviors. Possible appearance of stereotypes, repetitive movements without an apparent end. High heart rate and respiratory rate. Excessive salivation, high energy metabolism. High body temperature. Reduction of urination. Would you like to have more professional information, and especially updated about your dog? Visit the website that is located below in the description of this video. Do not forget to subscribe to the channel, comment, and share the video. You are very well, thank you.